Area Info 99.3. Let's talk.
Let's talk Lagos, Nigeria. Welcome to Hard Facts here on Nigeria Info 99.3. I'm Sheriff Quadry. That's right. Let me quickly drop this news that tomorrow's I Beg to Differ is starting at 3 p.m. So there won't be Hard Facts tomorrow at all. And here is the reason. The reason is because Nigeria's match starts at 5 tomorrow, which means that we would have to cover that match. So we have moved I Beg to Differ an hour earlier than the usual 4 to 3. So the match, I Beg to Differ match will start at 3. The first match starts at 3, ends at 4. Second match starts at 4, ends at 5. Then there will be live sports coverage for the Nigeria World Cup playoffs tomorrow at 5 o'clock. So that is the update. Please do not forget about the update. Welcome to Big 3, by the way. So the Big 3 today is supposed to be not Big 3, but maybe the big one. It's supposed to be a Big 3, but then we are moving it because on Friday the 14th, is the World Diabetes Day. And yes, we want to have a conversation today because my guest will not be able to make it to the show that time. So it's better for us to have that conversation today, especially because of the importance of the subject called diabetes, right? In case you are not aware, we're streaming live on Facebook. We're also live on YouTube. Nigeria Info 99.3 is how you can watch us live on Facebook and live on YouTube. My guest this afternoon on the show is a professor of medicine. He's a consultant physician and endocrinologist in Ugwu State University Teaching Hospital. He's the national president of Diabetes Association of Nigeria. I'm introducing none other than Professor Ejiofor Ugwu. Professor, good afternoon to you and thank you for joining us.
Good afternoon. I'm delighted to be here.
It's
Thank
a
you.
pleasure. It's a huge pleasure to have you here. And I understand that you should be, rightly so, a very busy person. So we're going to make this very short and straight to the point so we can get as much as possible from you, from your knowledge. Before we get on to this conversation, look, if you've got any question for Prof about diabetes, start dropping your questions via our WhatsApp portal. WhatsApp number is 0809 597 5805 on WhatsApp. That is 0809 597 5805. If you're watching on Facebook and on YouTube, you can drop your questions for Prof there as well. About 1 in every 14 adults in Nigeria may be living with type 2 diabetes. Over 10 million Nigerians, maybe even these particular figures are conservative in nature because you know how we are in Nigeria about data, right? About 10 million, over 10 million actually, may be pre-diabetic and at risk of developing full diabetes in Nigeria. And there's also this talk about some certain zones having this prevalence in double digits when it comes to diabetes, above 11% or so. We'll get to this in a moment. Let me quickly jump in this conversation with Professor Ugwu. Professor Prof, you're the national president of the Diabetes Association of Nigeria. So I'm sure that you have access to recent data. Let's start from the beginning. What exactly is diabetes, and what are the main types our listener, should know about?
All right. Thank you very much. Diabetes, in this case, we are discussing diabetes mellitus.
That's right.
Because there are other forms of diabetes. We have what we call diabetes insipidus, which is not the topic of discussion today.
Right.
So diabetes mellitus is a chronic health condition characterized by the elevation of blood glucose to a level that it becomes harmful to the body and the systems. And this is a chronic illness in the sense that it's not something that, comes and goes within a very short period of time. It's not malaria. It's not particles. You understand? So it's almost a lifelong disease. Okay. And that is just the best way to look at diabetes. Glucose is very important in the body. Everybody needs glucose to generate energy for the body's day-to-day metabolic needs. But when it is present in the blood in excess amount, then the glucose becomes harmful to the body. And that disease condition is what is called diabetes mellitus. Now, there are different forms of diabetes.
Right.
We have what we call the type 1 diabetes, which is usually common in children and adolescents. It's more prevalent in that age group. However, you can find it in any age group. This type of diabetes constitutes about 5 to 10% of diabetes cases, and it results from the complete destruction of an organ in the body known as the pancreas. It's not really the entire organ. The cells in the organ that produce a hormone we call insulin. Now, insulin, everybody needs insulin. Insulin is a very important hormone in the body that helps to regulate blood glucose, such that after a carbohydrate meal, the byproduct is glucose, and then the glucose gets absorbed into the bloodstream. It is insulin that helps in mopping up the excess glucose and then taking them to different cells and tissues where they will be used to generate energy. So in the case of type 1 diabetes, those cells, we call them the beta islet cells, have been destroyed by some mechanisms. And then the person now develops absolute insulin deficiency, and this is what we call type 1 diabetes. Now, the other type of diabetes is type 2 diabetes, which is the predominant form of diabetes, constituting about 85 to 90% of cases of diabetes worldwide. All right. So this type of diabetes, there is no destruction of the cells of the pancreas. However, the pancreas becomes unable to secrete adequate amount of insulin. So there is still insulin secretion in type 2 diabetes, but it's either the quantity is not enough or the quality is defective. That's what we call insulin resistance. So the pancreas is still producing insulin, but the insulin is not doing what it's supposed to do in the body. So this is the commonest type of diabetes, like I said, and usually occur in adults, mostly from the age of 45. That's when you find type 2 diabetes. However, it's not sacrosanct, in the sense that many children now, adolescents, young adults, are developing type 2 diabetes due to several factors that we may delve into in the course of this program.
No, Prof, we're going into it right now. Once you're done with this speech ban, because that is my next question. Like, why are we now having huge numbers of people, both old and young, coming down with diabetes mellitus? But please finish with your this first response.
All right, thank you very much. So the other type of diabetes is what we call gestational diabetes, which exclusively affects pregnant women. All right, it tends to occur or start in the second half of pregnancy, from 20 weeks and above, and there's a tendency for it to remit after childbirth. Usually within 6 weeks, after childbirth, it tends to remit. But of course, some people become permanently diabetic after some years. So it's a risk factor for development of, type 2 diabetes. Then we have what we call the specific type of diabetes, which constitutes a very, very minority, diabetes cases. In this case, diabetes is secondary to another illness. Somebody has got another sickness in the body and diabetes just becomes a complication, or maybe drug-induced people who abuse drugs, like steroids. All right. Then other diseases like thyrotoxicosis, acromegaly, there are different disease conditions that diabetes can become a complication of those diseases. So such diabetes is what we call specific type of diabetes. Now, let me say that there are other forms of diabetes that are being discovered. So this is not exhaustive, but these are the main type of diabetes. Now, I don't know if you want us to go straight into why young people are now.
Let's go right into it, Prof.
Very good. It's really mind-boggling. It's something that is very worrisome, that many young people are now developing type 2 diabetes, a disease that was hitherto reserved, so to speak, for elderly people. All right. And the problems are multifactorial. Number one is childhood obesity is on the increase. And obesity is one of the potent risk factors for development of type 2 diabetes. So you see a lot of, especially when you go to the cities, The urban areas, you see a lot of chubby children, children who appear very fat, obese, or overweight. So that is one of the reasons, because obesity, predisposes to insulin resistance. That is qualitative insulin deficiency, which is what I described before. And that's why one of the reasons. The second reason is lack of physical activity among our children. I don't know where you grew up, but where I grew up in what I could describe as a free-range system, where we were running from one house to the other. Even in our schools those days, primary school and other, we had large playgrounds.
That's
we used
right.
to do a lot of sports.
That's right.
You understand?
That's right.
Now, compare and contrast it with what's happening in urban areas today. You understand? Private schools are the order of the day, and most of these private schools don't even have adequate playgrounds. Okay, most of them are cramped. The children are just in their classrooms with television sets and air conditioners and all that. All right, and these children stay there. And again, when I was going to school those days, this thing we call school run was non-existent. Our parents don't used to take us to schools. We used to trek to schools. But these days in the morning, you carry your children in your car, you go and drop them in the school. They stay inside the room there until they dismiss. And then when they come back to the house, they stay inside the house, locked up, confined in a compound. You understand? And they play video games and use their computers and all that. So children are becoming less active. They are becoming more sedentary. And sedentary living is one of the very important risk factors for the development of type 2 diabetes. All right. And then another major factor, which we cannot overemphasize, is unhealthy diet. Unhealthy diet. The kind of things children are eating these days are very, very unhealthy. Children are now being fed refined sugars, refined carbohydrates, saturated fats, in the form of, junk food, all right? Junk food and all that. So unlike those days when we used to eat, complex carbohydrates, so these unhealthy living, in fact, children are consuming a lot of sugar-sweetened beverages. And this is one of the reasons why. There are other factors, but these are the most important reasons why the age of onset of type 2 diabetes is gradually decreasing.
Well, Prof, how about the young adults? I mean, you've talked about the children. How about the young adults? Tell me about why we're having huge numbers for young adults coming down with this thing.
It's still the same, because who are the young adults? The young adults are adults who were once children, and they shared all these risk factors when they were children. You understand?
Yes.
Remember that when diabetes doesn't just develop overnight. All right. So even these children that are, maybe nursery school, primary school, that are accumulating all these risk factors, most of them will develop it when they now become young adults. All right. So it's still the same spectrum.
All right. But let's move on. Let's take this a bit higher. If you would like to ask Prof a question, I can take one or two calls as I drop my own questions. So feel free to dial in. Okay. But Prof, let's talk about the early warning signs of diabetes that people often ignore. I'm not talking about the obvious ones. We'll talk about the obvious ones. But those early warning signs that people just look at it, no, there's nothing. What are those signs, early warning signs?
All right. Let me start by saying that majority of people who develop diabetes do not even have signs. That is one of the reasons why diabetes is, quote and unquote, a dangerous illness. You understand? Because one can have diabetes for 2, 3, 4 years without having any symptom or sign, what we call asymptomatic presentation. And that is why we advocate routine screening, regular health checks, instead of waiting for symptoms or signs. However, for those who develop, symptoms or signs, we're using them interchangeably in this discussion.
Right.
We have what we call classical symptoms. Classical symptoms where the individual begins to, develop excessive urination. That's what we call polyuria. Then becomes unduly tested. The person feels like gulping gallons of water. That's what we call polydipsia. And then the person also develops excessive appetite. We call it polyphagia. And then unexplained weight loss, unexplained involuntary weight loss. The person is eating, adequately, and yet is losing weight. These are the classical symptoms. However, you find these classical symptoms in less than 30% of people who develop diabetes, especially type 2 diabetes, which is the most predominant. All right. So a lot of people who develop diabetes come down with signs of complications. They've been diabetic for quite some time, unnoticed, undiagnosed, untreated, and they are just coming with symptoms of complications. For instance, if you go to the eye clinic, a lot of people come there to complain of blurry vision. They are unable to, their vision is declining. And it's only there when they are checked, when the blood glucose is checked, they discover that they have diabetes, which has, been causing, damage to their eyes unnoticed without causing any other symptoms, those classical symptoms that I mentioned.
Right.
And then they are now coming down with what we call diabetic retinopathy or premature cataract and all that. Some other people develop recurrent infections in the private part, especially women. All right. Some people come down with, wounds, what we call diabetic foot ulcers on their feet, and they present to the hospital because the wound has been there for quite some time. They've done all the basic things, and the wound is not healing.
Right.
And it's only there we discover that they have underlying diabetes. So these are already signs of complications. So no individual should wait for symptoms or signs before evaluating the person's diabetes status.
Right. Prof, we're going to head out now for a very short break. We need to take this break. When we return, we will talk some more. Lagos, if you're just tuning in, you're most welcome. We're streaming on Facebook. We're also live on YouTube, so you can drop your questions for Prof on Facebook and on YouTube. Or you can just send Prof your question via our WhatsApp portal. The WhatsApp number is 0809 597 5805. I've been speaking with Professor Ejiofor Ugwu, Professor of Medicine, and is a consultant physician and endocrinologist as well. We'll be right back in a moment. Stay with us.
99.3 Nigeria Info. We'll be right back. Every day is about winning with one play on Nigeria Info. On Nigeria Info, daily winnings is now over 150,000 naira. Just go to oneplay.ng or dial *347 *880 #3#. Play with as little as 500 naira, and in a few seconds, your ticket is in the draw. The more you play, the better your chances of winning every day on the Morning Crossfire, What's Up Lagos, and Game On shows on weekdays, and the Football Frenzy shows on weekends. But that's not all. Every Friday, there will be a 500,000 naira jackpot. Playing during the week automatically qualifies you for the weekly jackpot. Your chances of winning are the same whether you play on oneplay.ng or dial *347 *880 #3#. Remember to play responsibly. Not suitable for persons under the age of 18. OnePlay is a registered trademark under Lasho Trading Services Limited, licensed by the Lagos State Lotteries and Gaming Commission.
Are you finding it difficult listening to your favorite talk radio Nigeria Info via the mobile app? Come closer. Let me fix that for you. Now, launch the app on your device. Click the 3 lines on the top left corner of the app. Look for settings in the drop-down menu and click on it. Turn on the first option that you see. Make sure you turn on the option that says always use highest quality available audio. Now that you have done that, close the app and relaunch it. Voila! I did it! Well, sorry, you did it. Now you can enjoy your radio anywhere, anytime. Nigeria Info. Let's talk.
Is where it all connects, all in one place.
Federal government says it is winning the war on terrorism.
Our president is there. This promise will never come to pass.
That he feels somewhat insecure just by the measure of his money.
Most of us don't even know the nooks and crannies of Nigeria. If everybody die, which voice is going to speak?
Yes, and Wike is one of the major actors in the demise of the PDP.
Getting judge fit in Nigerian court is not possible.
The news, conversation, information, and more. 99.3 Nigeria Info. Let's talk.
Lagos, Nigeria, welcome back to Hard Facts here on Nigeria Info 99.3. I beg to differ. Secondary schools debate tournament starts at 4 p.m. here on Nigeria Info 99.3. Please stay tuned for that. On Hard Facts today, I have joining me Professor Ejiofor Ugwu, a professor of medicine, consultant physician, and endocrinologist at Enugu State University Teaching Hospital. He's also the National President, Diabetes Association of Nigeria. Friday is World Diabetes Day, and we are having a conversation on that. Prof, thank you again for giving us your time today. I hope to have more conversations, more discussions with you on this particular situation. But let's take one or more calls before we move on to other areas of this conversation. 0201 2770 993. That is 0201 2770 993. Female only line is 0201 465 7190. I can see your messages on WhatsApp, so I'll be taking your messages as well. Please turn off your radio and please do go straight to the point if you've got questions for Prof. Good afternoon to you. Good afternoon.
Yeah. Yes, good afternoon.
You're going to have to call me back. I'm sorry, the line got distorted in a way, yeah? Do try and call me back, and then I will take your call, all right? In the meantime, I think I can check this one out. This was, what's this message about? Okay, I think I have a call. Let me jump on this call here. Good afternoon to you.
Good afternoon, Sheriff.
Yes, please.
Okay, third man here.
Let's hear you.
So I wanted to ask in the genealogy, like some people in their family lineage, they kind of have this trait of diabetes.
Okay.
Is it possible for someone who does not have that in his trait, in his family lineage, to now get into the disease easily?
Are you asking if it's hereditary? Is that what you're asking?
Yes, it is hereditary.
Okay.
Or is it easy for someone who is not in hereditary to easily get the disease?
I don't understand the second question.
Is it majorly hereditary, that is diabetes? Is it majorly hereditary, or someone who doesn't have it in his heritage?
Okay, can catch it. All right. Okay. Prof, did you get that question? He was asking if
Yes,
it's...
I got it.
Okay, good. Let's have your answer to that, Prof.
All right, thank you very much. The caller already knows, and rightly, that cases of diabetes could be hereditary. All right, so that's what we call familial transmission. You can find it in both type 1 and type 2 diabetes. That's right. But what he wants to find out is whether it's possible for somebody who doesn't have a family history to develop diabetes. And the answer is capital yes. Capital yes. Family history is just one of the risk factors for development of diabetes mellitus. All right. And of course, one thing about family history is that there's nothing you can do about it. Once you have inherited the genes are there with you. All right. So we call it non-modifiable risk factor. Just like, advancing age. As you are getting older, your risk for developing diabetes increases, and you cannot reverse your age. At least science hasn't gotten to that level yet. All right. So, but if you don't have family history and you have other risk factors, you can still go ahead and develop diabetes. If you have, a lack of physical activity, you eat unhealthy diet, you are overweight or obese, all right? So even in the absence of family history, you can still develop diabetes.
Indeed. Let's take another call, Prof. Good afternoon to you.
Good afternoon, Mr. Sheriff. Good afternoon to the doctor as well.
Yes, please.
My question to the doctor is, for my husband, I think he got it from his mom. And I discovered that with consistent use of conventional drugs came a backlog of side effects. So I employed the use of food and discipline, more like abstinence from sugary things, to deal with his issue. And now his vitals are the better for it. So my question would be, am I on the right track, or should we still go back to conventional drugs?
Oh, okay. Brilliant. Thanks for calling. Prof?
Thank you, madam. You are on the right track if you are working in conjunction with a qualified healthcare professional. All right? Actually, the recommendation for managing diabetes is that you have to start with diet and lifestyle modification. Diabetes is largely a lifestyle disease. Okay? So even if you consume all the medications in the whole world without modifying your lifestyle, you understand, you are still going to achieve little or nothing. So it's very important for any patient living with diabetes and anybody who wants to prevent diabetes to modify his or her lifestyle to a healthy one. So, madam, that's why I say you're on the right track by making sure that your husband eats healthy, and I'm sure he has also stepped up his level of physical activity. But why I say that you have to do this in conjunction with a healthcare professional is that lifestyle modification may not be enough to achieve good diabetes control. It may or may not. So it still requires a trained diabetes specialist to follow up your husband to decide whether those lifestyle modifications are enough, are sufficient. For some people, it will just be enough. All right. Why some people will require additional therapeutic strategies in the form of medications. And when you talk about side effects, that is why a healthcare professional should manage diabetes. You don't just go to go and buy over-the-counter medication. Anyway, almost any medication in this country now is over-the-counter. You can get anything over the counter. So it's wrong to just go to a pharmacy outlet, a patent medicine dealer, and request for drugs for managing diabetes. It has to be prescribed by a healthcare professional who will also monitor these side effects we are talking about. There may be a need to change from one class of medication to another if the person experiences side effects, or even to change the dosages. All right. So, but lifestyle modification is very important.
Very important. Someone sent a WhatsApp message and they're asking their 7-year-old wheeze, he or she pees a lot, and they're asking what could be the reason. Could this be what we're discussing? That's what they're trying to know.
It's all right. This is one of the misconceptions in diabetology. All right. Just like the person who asked about family history, there are people who believe that, once they don't have diabetes in their family, they cannot get diabetes. It's a very, very dangerous misconception. So this one is, people think that once you pee a lot, anybody who urinates excessively, has got diabetes. It is also not true. Diabetes is just one of the causes of polyuria, that is excessive urination. There are other things, that can cause, an individual to urinate excessively. Even as simple as urinary tract infection, excess calcium in the body, and so many other things. All right. So the best thing to do is take that 7-year-old child who is urinating excessively to a qualified medical expert to evaluate whether it's diabetes that is responsible for it or whether it's due to other causes, so that you identify it and then treat it.
Indeed. Let me take this call right quick. Good afternoon to you.
Yeah, good afternoon, Sherif.
Yes, please.
Maryann Okon from Pestac.
Welcome.
I just want to ask the doctor, is it true, somebody said it, that you can, on your own, jejely taking a medicine for an ailment, and that medicine will be working over time and cause you to get diabetes? Is it true? Thank you.
Did the person mention the kind of medicine before you go?
No. I didn't
Okay.
I didn't ask.
All right. Prof, did you get the question?
He wants to know whether medications that people are taking for other ailments can make them to develop diabetes. Is that right?
Right, sir. Right.
Yes. Thank you very much, our dear caller. If you listen from the beginning, I even alluded to this fact, when I was talking about a type of diabetes that we call specific, diabetes. All right. There are a group of drugs, steroids, for instance, prednisolone, dexamethasone, and people abuse these drugs a lot, especially for managing arthritis. There are some women, not just women, men, whenever they develop joint pains, they go to nearby, patent medicine dealers and they mix drugs for them. Most of the time, these people include all these steroids. You understand? So they are not doing it. I don't think they are doing it, out of wickedness. They are doing it out of ignorance. And they don't know that taking these drugs on long-term basis can predispose to development of diabetes. All right? So the same thing with some other, medication. And that's why we discourage drug abuse. Any qualified medical doctor knows all the drugs that could predispose to the development of diabetes. And sometimes if there's a need to use it, the person will just prescribe it for a very short period of time and then discontinue. But once you're exposed to it for a chronic, on a long-term basis, the risk of developing diabetes is high.
It's quite high. Someone wants to know if diabetes can... Well, the way they put it, they said is diabetes cancerous. I don't know if you got what they're trying to say.
Yes.
Okay.
I think I got what the person is trying to say.
Okay.
diabetes is not cancerous. Diabetes is not the same thing as cancer. However, one of the complications of diabetes is that it predisposes the individual to developing certain kinds of cancers. It's scientifically proven, all right, that diabetic patients, are at a higher risk of developing cancers than, individuals who don't have diabetes. Okay, so cancers like ovarian cancers, endometrial cancers, prostate cancers and all that. So being diabetic, for instance, is a risk factor for some of these cancers. But diabetes in itself is not a cancerous condition.
Indeed. We have another call here. Calls are everywhere and the messages are coming in droves. Good afternoon to you. Please turn off your radio, please. Thank you.
Hello?
Yes, please, we can hear you.
Yeah, good afternoon.
Let's hear you, please.
Then, I want to ask a question. If somebody during the cold or let's say rainy season, he urinates frequently during the rainy season, is it a sign of diabetes? Or then, if they come to the dry season, the person cannot even urinate in a day, he hardly urinates maybe once in a day.
Okay.
Please, can you help me?
It's all right. It's all right. Prof has heard you. Prof, he's scared.
Yeah, thank you very much. Thank you. Please don't be scared. All right. Like I said, just in a couple of minutes ago,
right.
It's not every case of excess urination that is equal to diabetes. All right. And during rainy season, you see, the body loses water in different, ways. We lose water through urine, that is by urination. We use water through stooling, where the body loses water through sweating, all right, and also through breathing. Okay. You notice that during rainy season or during cold weather, people sweat less. You understand? So the avenue through which the body loses water by sweating will now be channeled to urination. So that explains why an average individual, whether you have diabetes or not, tend to urinate more frequently during the cold season. All right. However, if you are urinating, unduly, you understand, you should know your usual habits. If you have to wake up in the night, for instance, 3, 4, 5 times to urinate, then it is wrong to ascribe it to the coldness of the season. It's better to go and check and be sure that diabetes or any other illness is not lurking around the corner before you just attribute it to the coldness of the weather. All right. But not all excessive urination is diabetes. We need to get this, correctly.
Indeed. Prof, before I ask my own question, someone sent a message via WhatsApp and they're asking if someone can come down with diabetes mellitus after the age of 70.
After the age of 70, the chances of coming down with diabetes mellitus is even 5 times. In fact, it's more than those who are below the age of 70. You see, the diabetes and age is a continuum. Because as you age, the organs in your body also age. You understand? So that those who are above 70 are more likely to develop type 2 diabetes than those who are 40 or 50 or 60, because their pancreas would have will be aging alongside with their chronologic age. And of course, their insulin secretory capacity will begin to decline. Insulin resistance may increase. Remember that once we are age 70, 80 and above, physical activity becomes less. As you grow older, you become less active. You understand? So in fact, that's one of the reasons why older age is a risk factor for type 2 diabetes. So above 70 is not immune to development of diabetes. In fact, they are more predisposed than those who are below that age. Thank you.
Prof, I want to talk to you before I go back to the telephone. The telephone lines are buzzing out of control, but I need to ask my own question now, which is about management. I want to ask you a two-part question, right? The first part is, okay, someone has come down. He's been diagnosed with diabetes mellitus. He's been prescribed the drugs to take. I've heard conversations from people who have used that drugs on the side effects of the drugs. I don't want to mention the drugs for obvious reasons. I've also heard that it's almost like doctors just want to push out these drugs to people. Please, if it's a myth, please correct it, Prof. How can one manage diabetes mellitus, especially type 2 diabetes? What's the proper way of management?
Well, there are 4 major strategies for managing type 2 diabetes. Number 1 is through diet. All right, the person has to change. If the person was guilty of unhealthy diet before, have to change, embrace healthy diet. That's number 1. Number 2 is increase your level of physical activity, especially if you were sedentary. All right. Then number 3 is medication. And this is where healthcare experts come in. I do not encourage any person diagnosed to have diabetes to self-medicate, because we know the potential side effects of all the medication we use to manage diabetes. We know what is called contraindications. For instance, if you've got diabetes and I got diabetes, it doesn't mean that we have to take the same medications. A particular medication that may be helpful to me might be harmful to you based on several factors. And that's why they should be prescribed only by a qualified medical expert, so that the person will know who shouldn't take a particular medication, who should take a particular medication, what dosage should be given to you, and what dosage should be given to me. All right. So, and there are different classes of medication for managing diabetes. Some are good for, in fact, managing diabetes now, we use the word personalization. You have to personalize the patient.
Okay.
All right. So if the patient is obese, is fat, for instance, it's not the same medication that the person will require that you give to somebody who is slim, who has lost so much weight. All right. So, and if the person already has, maybe organ dysfunction, like presence of kidney problem, there are some anti-diabetic medication that he shouldn't take. If you give him those medications, it may worsen the kidney problem. And there are some drugs that he may take that will help to control both the diabetes and also, improve the kidney function. So the individual has to be, personalized. And then the 4th strategy, apart from medication, is monitoring. It's not just enough to be taking medication. There is need to monitor the efficacy of these medications. Are they really achieving the desired goals? And this brings us to, apart from the day-to-day blood sugar monitoring, there's what we call glycated hemoglobin. Glycated hemoglobin testing is the gold standard for monitoring diabetes control all over the world. And you see many patients who are suffering from diabetes who just go to chemists, buy these drugs, and they are taking it for years. No monitoring is in place. So the efficacy of the therapy is not assessed. All right. So monitoring is very important. And when we are monitoring, we're not just monitoring the glucose. All right. We're not glucocentric. You have to monitor complications, annual screening of complications, dilated fundoscopy to look at the eyes, checking the kidneys, looking at the nerves, the feet. Do you understand? So that's what we mean by monitoring. So these are the strategies for managing diabetes. And like I said, managing diabetes is a multidisciplinary approach. All right. So the endocrinologist or the diabetologist has to be at the forefront, but there may be a need for other specialists to come in, like a podiatrist, that are, those who specialize in managing food conditions, ophthalmologists that will look at the eyes, dietitians that will prescribe personalized diets and all that. So it's a multidisciplinary approach. It's not something that you just go buy a drug from chemist and take it and say you're managing your diabetes. No, it doesn't work that way.
Prof, let me go take a few more calls, then we'll take some messages, because my next question will be about reversal, whether that's a myth, because I've heard stories, whether it can be reversed, especially type 2, whether it can be reversed, and what your thoughts on that. But let's take a few more calls, then we'll take messages before we come to that. Good afternoon to you.
Hello, good afternoon.
Yes, please.
My question is...
Please turn off your radio quickly.
Yes. My question is, diabetes, is it a metabolic issue or problem that if you eat carb or glucose and the cells refuse to take it in, can it be cured by stopping carbohydrate, the intake of carbohydrate and sugar? I'm believing strongly that.
No, don't answer your own question. Is that the question?
Okay, that's the question.
Okay, yes. All right. Thank you. Prof.
Thank you very much, the caller. It still boils down to one of those myths, one of those misconceptions in diabetology. right? That diabetes is caused by glucose, or consuming glucose or carbohydrates. That is not true. Okay. Yes, I mentioned from the outset that every human being needs glucose. Everybody needs carbohydrate. In fact, without carbohydrate, you cannot be in the studio there. Because that's where you are generating energy from. You understand? Exactly. It's just like the petrol you put in your car. Without it, your car will not move unless you have electric cars. You understand? So glucose carbohydrate is not the problem. The problem is the type of carbohydrate that you consume. All right? And then the quantity. So the quality of the carbohydrate and then the quantity of the carbohydrate. All right? Then the caller was asking whether if one stops eating carbohydrate, whether the diabetes could get cured. Of course, the answer is a capital no. Number one, you cannot stop eating carbohydrate. It's not possible. Some people come and tell me that, they've stopped eating a certain food and all that. I say, okay, what do you now eat? They now mention the food that they eat. I say, these things are also carbohydrates. You understand? So nobody can completely remove.
Prof's link.
Carbohydrate in your meal. Then secondly, because the brain cannot use any other source of energy except glucose. If you stop carbohydrate meal or you reduce your carbohydrate meal to a level that you're no longer getting, sufficient glucose from food, the body will start manufacturing its own glucose to feed the brain. That's what we call gluconeogenesis in us. The body will get the raw materials from you, from inside you. So the body will start melting your adipose tissue. That is the fat in your body, your muscles. You understand? After depleting glycogen store in your liver. And you now see the individual getting leaner and leaner and leaner with muscle wasting, muscle atrophy. You understand? The person starts getting weaker and weaker. So the blood sugar will still be high, even when you're not eating carbohydrates. Yes, your blood sugar will still be high because the body is going to be manufacturing glucose to supply the brain. All right? So the problem with diabetes is not necessarily because you are eating carbohydrates. It's the type of carbohydrate you are eating and the quantity that predisposes you to developing diabetes. Then remember again that unhealthy diet is just one of the risk factors.
Right.
So that you are eating good carbohydrates and taking it in the right proportion does not mean you cannot develop diabetes. What if you've got a family history? What if you have a sedentary kind of lifestyle? What if you're overweight or obese? What if you are taking medications that are diabetogenic? You understand? So multiple risk factors can combine together to lead to diabetes manifestation.
So I think you've answered this next question that this person sent in. They wanted to know what are the things to do and to eat to avoid diabetes. They want to avoid diabetes, so they're asking what are the things to do and to eat. And in your submissions severally, you've talked about meal, you've talked about the quantity and the quality and all of that. I am guessing that they should have a clue of what to eat. And Prof, do you want to say something about that?
I just want to probably to make it clearer to them because, sometimes when we're saying complex carbohydrates, processed food and all that, some people don't really get it,
Okay, that's fine.
Precisely.
That's fine.
Now, any food that has undergone some kind of processing, that machine has worked on it, you understand that, particles have been removed, maybe the chaff, the bark and all that. The thing has been turned into a fine flour. It is a refined carbohydrate. All right? So just imagine, just evaluate yourself what you eat on regular basis. Ask yourself, has this food undergone industry processing? Or is it almost direct from the farm, as in, the way it was, natural,
Right.
almost unchanged from the farm? For instance, if you get, I'm just using wheat, for instance.
Okay.
Wheat grains, you understand? So when you produce wheat grains, and then you now grind the wheat grains and then you turn it, into a paste and swallow it. That is not a processed carbohydrate. You understand? Now, but if you now turn that wheat into biscuits, for instance, the kind of, process it's going to undergo before it becomes biscuit.
Right.
Okay. So that is exactly what I mean by complex carbohydrates and refined carbohydrates. So let's try as much as possible to eat natural, food that is as close to nature as possible. Just imagine the kind of food that our grandfathers and forefathers ate. All right. So, and I've already talked about being physically active. The World Health Organization recommends that every adult should have at least 150 minutes per week of aerobic, moderate intensity activity. All right. You can decide to space it, maybe like every day you do like 30 minutes. Okay. So this could be in form of brisk walking, jogging, swimming, dancing, cycling, you understand?
Mm-hmm.
So whichever one that you can do, yes, provided that you are not completely sedentary. Mm-hmm. Then you also have to watch your weight. All right. You also have to watch your weight, because overweight or obesity, will predispose you to developing type 2 diabetes.
Prof, we must go now. I can't take the many messages that we have here. But please, what would be your parting shot for my listener right now as we get set to commemorate World Diabetes Day?
Number one, go and check your diabetes status today. Some people who are listening to us may have diabetes, but they are not aware. Some may have pre-diabetes. Some have family history. In fact, and let me say that absence of family history does not mean that there's no diabetes gene in the family. Somebody may have lost, his mother or his father, you understand, before the person manifested with diabetes, but the person has genes, okay? So it is recommended that every adult should check his or her diabetes status at least once in a year. If you check it and the result is normal, you repeat it, once every year. All right. But if it's abnormal, if you belong to what we call pre-diabetes, then you have to check it more frequently, like 2 or 3 times in a year. So that is my message number one. Message number two is everybody listening to us today should please have a resolution to change your lifestyle to prevent diabetes. We all know ourselves. You can audit yourself, the kind of thing. There are some people who no longer eat with water. Anytime they buy food, they buy soft drink. That is unhealthy habit.
They want to step it down. They call it step down.
Yes, exactly. Because that soft drink that you are buying is a sugar-sweetened beverage. A bottle of soft drink contains not less than 12 to 14 cubes of sugar equivalent. And this is what people consume every day in the name of trying to, to join the bandwagon. All right. So if you know anything that you are eating that can predispose you to diabetes, please drop it. All right. So these are the key messages I have for Nigerians. All right. I don't know if there's time because I actually wanted to talk to governments.
Please go on, Prof. You have. I can give you 2 minutes.
Thank you very much. Thank you. The Diabetes Association of Nigeria, DAN, which I represent, we are calling on the federal government, in fact, government at all levels, to declare diabetes as, a state of emergency, to declare a state of emergency in diabetes in Nigeria. Because, as you rightly mentioned, over 11 million people are living with diabetes in Nigeria. And this represents only less than half of those who have the disease condition. The rest are not yet diagnosed. And most of these patients are having difficulty accessing care because the cost of care has increased exponentially beyond the reach of an average Nigerian.
Right.
Government needs to step in now because the morbidities and mortality, that's the death rate from diabetes in Nigeria right now, is very, very alarming. Over 30,000 Nigerians die every day from diabetes, and this is increasing. Every year, yes. Annual death rates from diabetes in Nigeria is over 30,000. You understand? And this is increasing every year. Now, the Nigerian government needs to subsidize diabetes medications immediately. There are some medications, essential diabetes medications, that diabetic patients require almost on daily basis, and most of them can no longer afford it. So we are calling on the Nigerian government to please come in, step in immediately, grant subsidy to some of these essential diabetes medications. Then secondly, the government needs, as a matter of urgency, to try to remove the importation tax on diabetes medications and consumables.
Okay.
This will reduce the landing cost of these drugs because most of them are manufactured outside the country. All right. So, but after taxation and all that, they will be landing to, into the country at a high price, and most patients can no longer afford it. All right. Then we're also asking the Nigerian government to set up what we call the National diabetes policy and strategic plan. Bring stakeholders together and let us discuss, let us formulate policies that will help in diabetes prevention and management in this country, because we cannot contain the way this disease is ravaging the country, right? So, and then the National Health Insurance, we are begging the federal government, ably headed by President, Bola Ahmed Tinubu, to please expand the National Health Insurance Scheme to make it more comprehensive, to include most of the diabetes medications. They are consumable, like blood glucose testing machine and strips.
Brilliant.
Right?
Brilliant.
And especially in rural areas, all these things are almost non-existent. So this is our message, this is our plea, this is our cry, and we believe that the government is listening, and we believe that we have a sensitive government that can listen to the yearnings and aspirations of the people and do something before it is too late. Thank you. Professor
Ejiofor Ugwu, Professor of Medicine, Consultant Physician, and Endocrinologist, Enugu State University Teaching Hospital. He's the National President, Diabetes Association of Nigeria. Prof, thank you so much. You've been amazing today. Thank you.
It's my pleasure. Thank you very much.
Lagos, that's our show. Let's gear up now to join the debaters on I Beg to Differ Secondary Schools Debate Tournament. I'm Sheriff Quadry. Don't go away. This is Nigeria Info 99.3.
The news you need. The conversation.
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.